The sacrum is a large, flattened, and triangular bone. It is formed by the fusion of the 5 sacral vertebrae. That is a sacral vertebral first, second, third, fourth, and fifth. It is triangular in appearance. It is having a superior base, or you can say the upper surface, an anterior pelvic surface, a downwards pointed apex, two lateral surfaces, that is a left lateral and the right lateral, and one dorsal surface. Anatomically, the anterior pelvic surface is directed forwards and slightly downwards. The base, when viewed laterally, makes an angle of 30 degrees with the horizontal. And viewing superiorly in the anatomical position, one should see the bottom of the floor through the sacral canal. Superiorly viewing, there are certain peculiarities in the sacrum. Firstly, we can see the large body resembles with the lumbar body. It articulates with the 5th lumbar vertebra with the lumbosacral joint. Two laminas projecting backwards and obliquely towards the midline. Besides, the anterior margin of the body forms what is known as the sacral promontary. And of course, the lateral extensions are thick and massive. They form the ala. The anterior surface, also called the pelvic surface, is concave forwards. It is marginated by 4 transverse lines, indicating the fusion of the 5 sacral vertebrae. Also, we have the intervertebral foraminas for the respective spinal levels. And of course, the large lateral crescent margins. The dorsal aspect of the sacrum bone, it is irregular, massive, and convex. Further, we can see 4 pairs of dorsal sacral foramina. We can't see this in this specimen, but there is a median sacral crest, which is formed by the fusion of the upper 4 spinous processes. For instance, here would be the first, second, third, and the fourth. Due to malfusion of the 5th lamina, at the bottom, we are able to see a U-shaped, you can't see it in here, but just imagine, a U-shaped sacral hiatus. The sacral canal runs in this gap. Further, moving laterally, we have the joined laminas. Further, just medial to the dorsal sacral foramina, we have the intermediate sacral crest, which is formed by the fusion of the articular facets or the articular processes. Again, the 5th articular process is malfused with the other, and as a result, it forms a tongue-like appearance called the sacral cornua. Moving further laterally, even lateral to the dorsal sacral foramina, we have the lateral sacral crest, which is formed by the fusion of the transverse processes. Coming to the sacral canal, which is formed by the fusion of the 4 sacral foraminas. Viewing superiorly in anatomical position, we'll be able to see the flow through it. The cross section appears triangular. Major contents involves the cauda equina, since the spinal cord is terminating at the lower border of L1 vertebra, continuing as the cauda equina. Surrounding spinal meninges are seen alongside the filum terminale. However, the dura mater and the arachnoid ends at the S2 level. The filum terminale will pierce the dura mater and the arachnoid mater and runs down and escape through the sacral hiatus. Through the sacral hiatus, the filum terminale gets inserted into the dorsum of the coxyx. The anterior aspect of the sacral bone, or the pelvic part of the sacral bone, has multiple related structures. the lateral aspect of the ala holds a relation with the psoas major muscle. Moving from lateral to the medial aspect of the ala of the sacral bone, with the mnemonic of OILS, oils, the structures involves the obturator nerve, which arises from the anterior division of L3, L4, and L5 spinal segments. It is a part of the lumbar plexus. Moving further medially, we find the iliolumbar artery. It is a branch of the internal iliac artery. Moving medially further, we'll be able to see the lumbosacral trunk. The lumbosacral trunk involves the L4, L5, S1, S2, and S3 spinal segments. Further medially, the final structure that we can visualize will be the sympathetic chain. The sympathetic chain, however, runs further down and meets at the anterior aspect of the coxyx and fuses together to form what is known as the ganglion impar. There are certain peculiar muscular relations or muscular origins and insertions over the sacral bone. One of them involves correspondingly to the levels of S2, S3, and S4, which involves an E-shaped origin of the piriformis muscle in the anterior and the lateral aspect. Further, the coxygeal muscle arises from the level of the lateral aspect of the S5 and the coxyx. Looking at the dorsal aspect, a U-shaped large muscular origin for erector spinae muscle, which arises from the median sacral crest, inferiorly winds upwards with convexity downwards and runs upwards again at the lateral sacral crest, between which lies the multifidus muscle origin. Also, slightly lateral and inferior aspect of the sacral bone dorsally involves the muscular origin for the gluteus maximus.